Hi, everyone. This is Gabby Panetta from Find Your Inner Zen in Toronto, Canada. And today I have the pleasure of speaking with Laura Hubley, who is a manual osteopath as well as a registered kinesiologist here in Toronto. Thank you for joining me, Laura.
Thank you, Gabby.
I mean, as you know, I've got this interview series to educate empaths, but pretty much everybody in general as to the different modalities and therapies that we can go to in order to bring our bodies back to balance. And osteopathy, I was shocked how wonderful it feels when I experienced it the first time. Well, actually, the second time with you. So tell us, what is osteopathy?
The loaded question.
Mm-hmm.
So osteopathy, manual osteopathy, I should correct it. And that's a really, a lot of people don't know that in Canada, it is manual osteopathy. We're not a regulated profession, which is why we're also part of this lockdown right now. We can't diagnose. So there's a little bit of differences there. So manual osteopathy is another hands-on therapy. It's very gentle, but the approach is very global. So we're really looking for that root cause of whatever is causing the pain, the symptom, the discomfort, the limitation, the symptoms of depression, digestion, kind of whatever the main complaint is. We're trying to get down to that root cause.
Okay. And because you've covered a wide range of symptoms. So how does the approach in treating conditions in osteopathy differ from other conventional therapies?
Because I think it is a more investigative global approach, and that is how your body works. It is a unit. It's never just one thing. Your body's a great mechanism. It loves to share the load. It loves to help out, but that leads to a ton of compensation, muscle compensation, altered biomechanics, altered structure, and then our function starts to change. So this is the relationship between function and structure and function, which is kind of the root of manual osteopathy, I should say, as well. So how those two relate to one another.
Okay. And what conditions could be treated with manual osteopathy?
Pretty much anything. The main ones we see often are lower back pain, headaches, tension, usually are kind of wear and tear, postural discomforts that people come into, especially now people are working from home, they're working at uncomfortable workplaces, and it's putting our bodies in a position that they're not really meant to be in.
Right. Now, I know that there's some, because I have a little bit of experience with craniosacral therapy, but I know that manual osteopathy also incorporates craniosacral therapy in it, and also visceral manipulation, which I mean, I want to know so much more about that. Can you tell us a little bit about both and how you incorporate them into the treatments?
Sure. So so the belief is that the cranium, so our head, our skull, our brain, and our sacrum are connected. And obviously we're connected through our spinal column. And through that column, we have that cerebral spinal fluid, and that acts as a lubricant, so to speak. So we'll explain this in layman terms as easy as we can. But that is where our messages are being sent. And obviously through our spinal column, that's where our nerves go out to the rest of the body, and that sends the messages for me to raise my hand, for me to cough, whatever the movement is. So when this fluid is very rough and wavy, think of a really kind of rocky stream, we're going to have broken telephones somewhere along the line. So this is where the cranial kind of comes into play. We really want to kind of soothe that cerebral spinal fluid so that our body can function the way it's meant to.
Right.
So that's kind of the cranial aspect of it. I personally don't do a ton of cranial work. I usually defer out to you for that. But it's definitely something that I would like to get a little bit more into. It does require a lot of touch and palpation and that feeling.
Yeah.
And then we have the visceral, which is also very much related to the musculature of the body. So our organs hang out in our body, and they don't just float around. They're in there with gravitational pulls and ligaments and fascia connections. And again, everything is connected. So when we, for example, sit all day and we're kind of in this compressed position,
Mm-hmm.
all of our organs are going to get compressed. All of those ligaments are going to get tight. And then we're going to get restrictions on how those organs function. So when we think about our liver, which is a big cleanser and detoxer, well, it's not functioning properly because it's been unable to because of
Right.
more physical restrictions. That's
Mm-hmm.
something we can start to take care of. Same thing with digestion, helping to move food or gas through. Are we experiencing constipation, diarrhea? So that's where manual osteopathy comes in. We're trying to really get that body back to its most neutral state so
Mm-hmm.
it can function and heal the way it's meant to.
Okay. So when I try to describe to clients what manual osteopathy is like, I tell them that it's kind of stretching and moving the joints. So can you describe what a typical treatment would look like?
Yeah. So most typical treatments are going to include soft tissue therapy, mobilizations, and muscle energy techniques.
Mm-hmm.
And what this does is it allows us to create mobility, create space, decompression, and get the body moving. From there, we can release neurotransmitters, we can increase blood flow, and we're basically waking the body up. It's really nice and gentle. I'm able to get the patient into positions that normally they wouldn't be able to get into on their own either.
Mm-hmm.
And I also incorporate a lot of breath work. So that's going to calm our nervous system. That's going to ignite our parasympathetic nervous system. And that's going to have a whole physiological effect on the body as we go through treatment.
Right. And I think also energetic. For me, movement is very important to just move the energy around, because we're not just a physical body. We're also an energetic body, and we're a mental and an emotional body. So I find that for me, osteopathy sort of releases any energetic cyst that may be stuck in a joint or somewhere that I'm not even aware of.
Yeah, absolutely. It's really flow, movement, mobility. Our bodies are made to move, whether that's through our structure and our function, but they're made to move. They're not made to sit all day. And we'll get restrictions. We need lymphatic flow. We need hormonal balance. And all of these diseases, infections, they all happen when we're out of balance.
Right. That would explain a lot.
Yeah. Right?
Yeah. Well, I'm finding that, well, I'm going through menopause has been a bit challenging for me, because I've always been used to having a high metabolism, everything slowed down for me. And then, the whole lockdown happened, and I haven't been as active like everybody else as I used to be. And I realize that every time I do become active, because I'm releasing toxins, I start exhibiting symptoms of what may seem to be an infection, but it's not. It's just my body releasing toxins. And so I start drinking more water. And the moment I start drinking more water, those symptoms go away. And I'm like, oh my gosh, I have to detox.
Yeah.
So
yeah. It's kind of like the flu. When you think about you have the flu, you're hot, you're feverish, you feel horrible. And it's also your body getting rid of all of that bad stuff, all of that sickness that's inside of you.
Right.
And I know in TCM, like that heat is really important inside to release those toxins and to cleanse. So exercise, revving the engine a little bit, getting the heart rate up, you're doing wonders for your body other than just physical movement.
Right. Well, we talked about how homeopathy helps balance the body emotionally and mentally. But say, for example, because you mentioned earlier depression, how do you deal with people who are going through either really tough emotional times, or have gone through a lot of sadness in the past few weeks or months? Maybe it's chronic.
There's a lot of that coming in these days. And by no means am I, this is beyond my scope. I'm not a clinical psychologist or anything. Unfortunately, I've been through a lot in my personal life, so I am able to relate to a lot of people. I really like to listen to them, not necessarily solve their problems. I think part of being a healer is helping that person heal themselves. And so what I'm doing in my treatment is giving them the tools. a big part of that is calming the nervous system. That's the biggest thing that I can do for them, because from there they can take that and go off with it. So that's really deep breathing, stimulating the vagus nerve, getting deep belly breathing. So a lot of the movements in treatment, as relaxing as it is, I'm actually having you work with me. So we're breathing in, we're breathing out during certain movements. And what that's doing is really calming our nervous system and really kind of pushing those feelings of depression and anxiety down so that we can be aware of them and then deal with them appropriately.
Right. And in your experience,
a lot of the time also people will have.
Oh, go ahead. The internet's breaking up a bit, so go ahead.
That's okay. I think we got a little bit of a lag. Yeah, that's okay. Another thing to keep in mind is our every 2 in a intracranial. As we hold on to tension, we're limiting blood flow and flow again through the body, but that's also going to have a big role on our hormones and our stress response and what we do outside. So there is a big physical and emotional, psychological connection.
Yeah, there is. Who is your ideal client? I think the internet is bugging up again. Yes, it is. Okay. So just to, while we wait for the internet to come back properly, one question that I wanted to ask you is, okay, so we are back. We had a bit of a glitch there. What was the question I wanted to ask you? Yes, there's, oh my goodness, I just got lost in.
It's also really good for helping with memory.
Oh, thank you. I had it right here.
That we all have.
Yes, the menopause brain.
Yep.
But there is something about the barriers to healing. With clients, what do you find are the biggest barriers to healing?
Probably more of the psychological, the in medicine. Gut health is a really big thing. That's why I often get into sleep. I get into digestion. So I kind of dive into everything, whether it's my area or my scope. I like to gather all my information so I can defer out. So if I hear someone's not sleeping properly, or their diet is very poor, or something that they've been struggling with, it's definitely something I'm going to defer out to, because then that is going to limit my
right. And I have the same approach.
As you know, I'm clinic director at Humana Health as well. Yeah, and we've got a great team. So in order for us to fully help our patients, we have to work as a team, because that's how your body works also.
Right.
So and it's only fair to treat the body the way it works.
Right. And, to have that access to the different practitioners is amazing. And that's the first thing that when clients come to me and they say, I suffer from depression, the first thing I ask is, what's your diet like? And they go, what does that have to do with anything? It has everything to do with everything. That's where you're starting your building blocks. If you don't have the nutrition, everything else is going to be thrown off.
Yeah.
So, okay. So now, now that I'm back into focus, I wanted to ask you, so walk me through a typical consultation with you. If I'm coming in for an initial assessment, what would you go through with me?
So first thing I do is I observe how you come in. How do you come in? How do you sit? How do you hang your coat up? How are you sitting on the table? This says a lot about the person. It gives me an idea of how much pain or discomfort they're in. Are their physical movements limited? But you can also tell, are they making eye contact? Are they staring at the floor? Are they kind of hyper, using their hands all the time? Are they you know, holding themselves. So that's the first thing I'm going to notice is purely my observations. Then from there, I'm going to get into the main complaint, and that's usually pain. So it's usually back pain or headaches. Sometimes we're getting shoulder pain and whatnot. From there, then I'll kind of dive into everything. So I'll go through what your typical day is like. As I said, we'll go through sleep. We'll go through diet. For women, a big one I go through is any pregnancies. Were they C-sections? Were they vaginal? Any therapy after? Is there any incontinence, bloating, cramping? So I really get a huge kind of global picture from the beginning, which then when I start my physical assessment, it usually starts to add up. You'll start to see the connections between the two.
And that brings me to a question with regards to female and male pelvic health, which isn't really talked about very often.
We have them.
Right. So how can you help somebody that is going through, and first of all, what does an unhealthy pelvic region, how does it affect our symptoms, or what symptoms do people exhibit when pelvic health isn't optimal?
So pelvic health affects everything. It is the hammock, the base of our bodies, and it has to support everything, or everything's going to fall out, right? So usually in most people, this pelvic floor, unfortunately, is usually very weak and very tight. And that causes an influx of issues from there, ranging from reproductive issues, painful periods, endometriosis, but it also causes back pain, sciatica, hip issues. What I'm looking at the pelvis is its positioning. Is it anteriorly rotated? Is it posteriorly rotated? Where is that sacrum position? And I'm, again, trying to get that pelvis back into its neutral form. Many people hear me say this. I call the pelvis Young and Dundas Square. It's the busiest intersection. There's muscles, ligaments, everything crossing in all different directions. And that's often where we're going to have the most accidents, so to speak, right? And it's going to trail off onto the arteries. We're going to have hip pain. We're going to have knee pain, back pain. You name it, it's all, in my view, it kind of stems from the pelvis. So if I can get this pelvis sitting again in its neutral position, I'm giving the body a chance to then heal itself, basically.
Nice.
So again, I'm giving the patient the tools to then go and do the therapy that they need to after. So whether they are working with a pelvic floor therapist or with a physiotherapist out on the floor, I'm trying to get that pelvis position, body position in its most neutral alignment. So it's available to go out and strengthen and maintain that position that it's happy in.
Nice. Okay. See, so much to do and know about osteopathy. All I know is that whenever, yeah. And I mean, for me, it's just a matter of self-care, but when I leave, I feel so amazing. And it's so different from massage and yet so beneficial. It's almost, and I don't know if it's just because I love getting treated, but I find that it's just different. It literally opens up my energetic field, and I'm very much about energy. So for me, it has to be energetic as well. And I feel it, like I and I feel when you're twisting and turning and I think, oh, I hadn't done that before. But you're sort of able to bring the body to, like you said, positions that we wouldn't normally go into, and ranges of motion that we didn't think we could do, but we're meant to be doing to open up the energetic field.
Yeah, exactly. And to do these movements without hurting or injuring anything.
Right.
And a lot of us we don't have the mobility. So I can't expect you to grab your knee if it means you're going to strain something else, which is again why we incorporate so much breath work, so that when I am going through those movements, we're actually able to go through those movements and you're not restricted.
Right. Wow. Okay. So who is your ideal client?
Anyone. I love working with women. I love working with postpartum women, mostly because I can fully relate to them. I've had both a C-section and a VBAC with both my children. So I love hearing labor and delivery stories and kind of that post-pregnancy health. So I love dealing with that. Back pains, headaches. Again, anything that I personally experience, I love working with people. So I suffer from horrible headaches, as you know. I love working with people because I want to help them, knowing that I know what their pain is like. So I tend to gravitate to headaches, migraines, pelvic health, and then just global general relaxation and wellness.
Awesome. And can you give us one takeaway from osteopathy in general? Just one thing that you could say osteopathy is great for.
Oh my goodness, for balance.
Yeah.
I'm going to go with balance. I'm balanced by Laura, and that's really what I'm trying to do, is balance you out. I'm not a magician. I can't make miracles happen, but I can definitely help you on your path so you can make your own miracles happen.
Right. And as a registered kinesiologist, since I have you here, what is your probably the most important recommendation for clients in terms of maintaining their health?
Exercise and movement. Okay. Most definitely. Your body's made to move. Right. It has to keep moving. That's why we work so closely with Physio Felix and the other physios at Humana. It really is a group effort, and your body has to move.
Right, right. Years ago, when my grandmother was on her deathbed, I spoke to a gerontologist, and she told us how important it was, especially for the elderly, but in general for everybody, to move. When people don't move, and people in their older years, so my grandmother was 84 at the time, she said, for an elderly person to not move, it's the equivalent of us not moving for 7 days. So if your grandmother has been in bed in the hospital for 7 days, you would have been in bed for 49 days. Imagine not moving for 49 days. She said the body just goes boom. So please get her out. Move. Yeah, get her to get to, if she can get up and walk or move her joints. That's why there's so much rehab, even in long-term facilities. They've got to move the arms, all of the joints. They move you around from place to place because the body is not meant to be stagnant. So.
No, and it doesn't like it. It builds, we saw it with my father, who was hospitalized after just over a week, the bed sore that he developed, and that then of course led to a whole other slew of problems.
Right.
So really the key is movement and balance, really trying to kind of balance that body, mind, and spirit, the energy, the healing, the exercise, the nutrition. It really is a care package.
It's huge. Yeah. All right. Thank you so much, Laura. How can people contact you?
You can contact me at Humana Health, so uhealth.ca, number 647-499-8982. Or you can follow me on social media. I'm Balanced by Laura, so balanced by Laura. Right. You can find me on your page as well. So either on the clinic page or my Balanced by Laura Facebook or Instagram.
Awesome. And just one thing for our viewers is that because of the beauty of the lockdown, everyone can now access all of these services virtually. So even if you may not be able to treat them, and if they're not local, but you can at least.
Humana Health is still, absolutely. That's a really good point. As long as you live in Ontario, we can work with you. virtually that is. So if you are uncomfortable coming into the clinic, we are doing our services virtually. They're just as beneficial, probably a little bit more convenient right now, but either way, we'll definitely keep you healthy virtually.
Awesome. Thank you so much. It was wonderful speaking with you, and I look forward to our next talk, hopefully soon in the future. Okay. Bye-bye.
You too. Awesome. Gabby.